Hi, my name is Christian. I'll be doing the prenatal education precautions video. So the first thing that I would like to talk about is foods to avoid during pregnancy. One of the first things we want to avoid is unwashed vegetables, as unwashed vegetables can bring in bacteria such as listeriosis. Complications from this disease can lead to possible miscarriage. Another thing to avoid would be unpasteurized cheese or dairy in general, as this can lead to toxoplasmosis, and a complication from toxoplasmosis could lead to fetal blindness or early birth defects, or even brain impairments on the fetus or child. Another type of food to avoid would be um, deli meat or simply any type of cheese, as cheese and or deli meat can lead to possible salmonella, and complications from salmonella can lead to early miscarriage. Um, General foods to avoid would be fish containing mercury. Mercury obviously is very bad for the body and the nervous system. This is affected a lot more in the baby's nervous system as it's growing. Also, high dosages of caffeine can cause low birth weight and or miscarriage. When discussing over-the-counter medications, it's highly recommended to discuss it with your physician before taking anything, including Tylenol, ibuprofen, all those things. Um, you definitely want to avoid any over-the-counter medication in your first trimester, because it has the highest risk for damage on the fetus. But regardless, you want to first advise your physician. Supplements during pregnancy are greatly encouraged, such as prenatal vitamins or even folic acid supplements. What this does is highly recommended because it can actually prevent, or at least help prevent, birth defects or anemia, especially when the mother is not having like a well balanced diet. Um, Another thing to discuss would be low birth weight. So, or simply low weight in the mother's part. This is very bad for the fetus. So, there's an ideal weight that we want to reach. And if they are low, then we want to, you know, increase that weight by taking like boost nutrition shakes, or even there's special powders like weight gainer powders to gain to the proper weight. Things that are contraindicated would be teratogenic drugs. These have a variety of very bad things for fetuses. So this can cause birth defects, fetal blindness, brain impairment, and simply overall structural impairment on the fetus, or even possibly miscarriage. The type of drugs that are typically teratogenic would be epileptic drugs or ACE inhibitors, and even warfarin. Um, Now, talking about environment, so the type of environment that we want to avoid during pregnancy would be avoiding hot tubs or even saunas. This has been known to cause neural tube defects in the fetus. Another thing would be cat litter, or even cats that they basically go to the bathroom and the mother can inhale it, like stray cats, and those cats can basically poop in the lawn or whatever. This can lead to toxoplasmosis, and it can actually cause fetal blindness, as discussed earlier. And lastly, another thing to avoid would be the radiation. So, simply any kind of high dose of radiation can lead to miscarriage. And this can be from going to the dentist or a type of surgery or whatnot. High doses of radiation can lead to miscarriage, very deadly for a child or a fetus. Things to avoid would be obviously alcohol, tobacco, or simply substance abuse in general are all very bad to avoid. Specifically, alcohol can cause fetal alcohol syndrome, or growth abnormalities. Tobacco is also very bad because it actually has nicotine, which is a vasoconstrictor, and a vasoconstrictor means that there is less blood flow, which can lead to one, lack of oxygen and nutrients to the fetus, but it can also increase the risk of bleeding. Also, nicotine damage can um, affect the lungs and brain of the fetus as well. And lastly, substance abuse. Substance abuse is obviously very bad for the mother and the fetus. This can cause placental complications, birth defects, and neonatal defects. Um, Very bad in general. Obviously, avoid it. So, traveling when you're pregnant. First and foremost, before you travel, you want to advise your physician to see if you're suitable to travel. Because when you go on an airplane, you're going to be sitting down, depending on your flight. Sitting down too long is bad, as this can lead to DVT. Um, to one thing to avoid would be to, one thing to encourage would be moving your legs, maintaining that good blood flow, not sitting down for too long, and we want to encourage compression socks. It is best typically to travel like within your second trimester, as the first trimester has been known to cause spontaneous abortion. And typically, the third trimester could cause like hypertension um, and preterm labor. So, travel preparation, things to know if you are going to travel and your physician basically okays it. You want to know your blood type just in case something happens. You also want to avoid any live vaccinations, such as the flu, as this can put an excessive amount of strain on your body, and then as well as on the fetus. You typically want to avoid like tropical islands because this can lead to the Zika virus. Um, and lastly, the dentist. Going to the dentist is obviously highly recommended, but it is more recommended when you're pregnant because the changes in the hormones can lead to like dental issues. Also, as we all know, when a woman is pregnant, they have cravings. This can lead to basically possible oral infections due to the variety of foods that they're ingesting. Typically, one visit the dentist in the second trimester, but because the third trimester, you don't want to be laying down on your back for too long, um, as that can cause the hypertension and etc. And lastly, same thing with the radiation. We want to avoid X-rays and anesthesia if we're going to go to the dentist, as those can have potential neonatal defects on the fetus. And that's pretty much it. All right. Thank you so much.